almost, let's say, 2 to 3 patients on a daily basis who comes to us with floaters, especially when you're looking against a white screen or the sky. You see some black spots moving around. The floaters can go up to the level that they can obscure your vision also. We live in the world where you want a crystal clear vision.
Hi everyone, welcome. And today we have Dr. Mandeep with us, who is an ophthalmologist and retina surgeon practicing in Dubai with over 22 years of experience. Thank you so much for joining us today, Doc.
Pleasure to be with you, Aditi, always.
Thank you, Doc. So, Doc, in your practice, you see patients coming in with different kind of eye symptoms, and I think the very common one is eye floaters. Now, I want to talk about that topic more today so that our patients understand that better. To start with the basic, how do you define eye floaters and what really causes it?
It's a very interesting topic, Aditi, because it's a very common symptoms that as a retina surgeon I see in my practice. Almost, let's say, 2 to 3 patients on a daily basis who comes to us with floaters. So when we are talking about floaters, the word itself explains it that in your vision, especially when you're looking against a white screen or the sky, you see some black spots moving around. You see certain kind of disturbance in your vision that wasn't there before. All right. So you start experiencing floaters on one particular day. They can go on increasing, they can go on decreasing. But what actually happens is you can see figures, you can see snake-like or ribbon-like materials floating around, and it's annoying you. So it makes things difficult for you to concentrate, because when you concentrate on your laptop, for example, you see a kind of swirl around it. So it annoys you. All right. So these are basic kind of floaters, and the floaters can go up to the level that they can obscure your vision also. So we're talking about floaters which are really massive, and they interfere with your vision.
Is the onset sudden? How would a patient know that there's something really happening there?
So what patient experiences it is he sees these floaters in his vision. So there are two kinds of floaters basically. How they originate, we can explain that. Acute floaters and chronic floaters. Acute floaters is something like you get up one day and now you suddenly start observing these movements in your vision and disturbance in your vision. So that's called as acute floaters. And then you've got chronic floaters where sometimes patients come to us. We ask them, "Do you see some disturbances?" Yeah, we there is a kind of small floater which keeps moving around, but it's okay. It's been there for many years. So etiology is the same, pathogenesis is the same, but it's just that acute floaters, we as a surgeons take it more seriously in comparison with the chronic floaters.
Doc, to take this a step further, I would like to understand what exactly is the mechanism behind eye floaters and what is exactly happening in the eye.
To understand this, Aditi, you need to understand the anatomy of the eye. So, just to give a perspective, the front of the eye that you see in any individual is just 1/6 of the eye. You have 5/6 of the eye which is hidden behind in an orbit, bony orbit. Now, imagine it like a ball, okay, and this ball has to have a content inside. The content is actually a jelly like material, what we call it as a vitreous. You are born with it, every child is born with it, and this is a very solid jelly when you are young. As you grow older, this jelly tends to become uh, liquid, it tends to denaturate, and what actually happens is at a certain age, it tends to detach from the base. So it is lining the whole inside of the eye, and now it's got detached and it tends to float in the center. And this is what we call it as floaters. This leads to floaters. All right. So you're basically seeing that detached jelly, and that's where these floaters are experienced.
So, Doc, is this age specific? Like, is this only a older people issue, or even young people can have eye floaters?
And that's an interesting question again. There is a rule of 70. That simply means at 70 years of age, 70% people would have experienced floaters in some form or the other. Okay, but that doesn't mean that you have to be 70 to experience it. Uh, Even youngsters can experience it. And I mean, on a daily basis, we have patients who come to us with, let's say, 40s and 50s, and they start experiencing it. But there are certain risk factors that you need to, which are associated with the floaters when they happen in a younger age. Typically speaking, myopes, people who wear minus power glasses. Okay, it's very common in people who wear minus power glasses to have floaters very early in the life. People who have had injuries, traumas to the eye, blunt traumas. People who have had early intraocular surgeries or any surgeries, any invasions done inside the eye. I suggest these are the risk factors, I presume, which would actually lead to early onset of floaters as well. There is also a lot of lifestyle changes now in terms of the sedentary life that we have. We are seeing that the floaters, the age at which you're going to experience floaters is generally coming down. When I started my career, we were always expecting floaters of a guy would like 60 plus and 70 plus would experience floaters, but every now and then now, these days I've got a patient of 40s and 50s who are experiencing floaters.
So, Doc, this is something that a lot of people are worried about. Maybe that is this an emergency condition, and how soon they should see the doctor.
Well, there are two aspects of it again. When we are talking about acute floaters, which literally mean that you get up in the morning from the bed and start seeing those floaters and disturbances, it's called as acute floaters. Anyone can experience that. All right. Those are the people who should be seeing an eye doctor immediately. More specifically, they should be seeing a retina surgeon. All right. And I would not say that this is an emergency situation, but it's only once you have been examined, a doctor can determine whether it is an emergency situation that needs a treatment, or it's just a simple floater which has not created any harm to the eye. So when I say that, you need to understand what I exactly mean. When these floaters happen, and I explained about the jelly, this jelly is in very close contact with an organ called as the retina, which is the curtain of nerves behind the eye that is lining the whole inside of the eye. When the jelly detaches, it can create certain harm to the retina in terms of retinal tears, hemorrhages, what we call as vitreous bleed, and sometimes even retinal detachments. So this particular complications because of the gel detachment is what we are wary about. That prompts us to call that, yeah, this is an emergency situation, not otherwise.
Doc, I would like to know that in terms of symptoms, is it only the vision, or is it associated with maybe pain or any other symptom that might trigger the patient that, okay, now I need to see an ophthalm?
Uh, a simple gel detachment is not associated with any other symptoms other than vision symptoms.
Okay.
There are certain floaters, certain patients who can experience floaters because of some secondary reasons. For example, there's a condition called as uveitis, which is inflammation of the eye. That's a specific condition where you will start seeing floaters with pain. But again, unless you visit a doctor, there is no way you can find out what is leading to these floaters.
And what exactly is the diagnostic procedure? Let's say if a patient comes to meet you, how does the evaluation process and consultation look like?
So whenever a patient is referred to us with acute floaters, we take it very seriously, and there are two ways to deal with these floaters. First thing is either we do a dilated retina examination, and dilated means you have got your pupils. We put certain medications to dilate the pupils so that our range of examination can increase, and we should be able to see the whole of the retina. If your pupils are not dilated, even with the best of the hands, best of the experience, a surgeon will not be able to see the complete retina. So either we do that, and there are special techniques which is called as indirect ophthalmoscopy. We do that to make sure that your periphery of the retina and whole of the retina is secure. We do have something called as non-mydriatic wide field imaging.
Okay.
Simply means it's a camera, it's a high-tech camera which takes photographs of the retina in different positions and reconstructs this image. It does not require pupillary dilatation. So very quick phenomena. We have it in our setup, and that is a game changer. So it's very quick. People don't have to get dilated. People don't have to wait for a long time. We just take a picture and we know exactly whether there is any injury to the retina. Certain specific conditions still would require dilatation, but that is 10% of it. And then we would be able to conclude if there is any retinal injury or not, and we inform the patients and take it forward. At the same time, if this is a chronic floaters, the process, the examination is the same, but yeah, the incidence of retinal tears, retinal detachments, or retinal injuries would be much lesser in these cases.
I have a question. Can a patient confuse the vision disturbances to cataract instead of eye floaters? Do you have patients who are like not sure of what is happening?
So cataract typically creates a vision symptoms or vision problems in terms of slow progressive drop of the vision. Acute floaters will emerge suddenly.
Okay.
All right. So they should not confuse it with cataracts, although they do. Many times patients do come late to us, and when we ask them, why didn't you see a doctor? They said, no, I'm old, so I presumed it's cataract. Cataract would not create sudden loss of vision, sudden disturbance of the vision. So they should not get confused between the two.
Okay. I was also reading about it and I saw that there are different patterns that patients are seeing. Some are seeing like squiggly lines, some are seeing like a ring pattern. Does it have any significance?
Yes, it does have a significance because when the gel of the eye detaches, uh, there is a base of the nerve which is called as optic nerve, which connects the eye to the brain. So there is a very hard attachment of this gel around the optic nerve. And when it detaches, the gel actually, there's a segment of the gel called V's ring, which is circular in nature. And initially, patients do come to us and say that I'm seeing a ring. So this is the most common uh, kind of floater that you see. And along with this ring, you've got the body of the gel attached. Now, let's say if the ring goes down and you're not seeing the ring, you are seeing the body of the gel, then it can form any kind of shape. It can just lead to poor vision, disturbance of the vision, the rings, uh, just disseminated, black spots floating around. It can take any kind of shape.
Perfect. So now I would like to discuss about the treatment options. Somebody comes to you with floaters. So are there different treatment options available, and how do you decide on that?
Well, first thing is the most common mistake that patients do, and some of my colleagues also do, is when the patients come to them, and I don't know why, but the dictum universally is uh, don't do anything about it. It'll go,
Okay.
because it's not something that is really going to steal away your vision from you unless it creates a retinal tear or retinal detachment. I don't agree with that. We live in the world where you want a crystal clear vision. There was an era when we were kids, you had a television where there were a lot of lines, a lot of disturbance, and we were still watching those televisions. Today, you own ultra high definition televisions and stuff like that. If you see even one line, you call your customer care. So if you want your gadgets to be perfect, why live with a subnormal vision where there are so many disturbances? So that's the reason the treatment options are important, and they need to be discussed with the patient. It's up to patients what they want. So treatment basically are, let's say, there is a four-step treatment, or four options which are available. There are certain supplements. It's not FDA proven, and these supplements are not even approved to be used in UAE. But there are certain supplements which include lysine, citrus extracts, and zinc, which have shown, and there is just one study which have shown that if you take them over a period of 6 months, your floaters can come down. It's not a proven modality. Second modality is eye drops. Again, it's not FDA approved. It is not available in UAE. So if someone is interested, they probably have to order it from outside the country. But this is again, I would not really say that 100% of the patients are going to be happy using this treatment. So these are diluted atropine eye drops. So it's called 0.01% atropine eye drops. Pharmacologically, they are not available. They have to be compounded in the pharmacy. Not a very safe option. And what it does is it just dilates your pupil. So what we are doing is we are bypassing that floater. When the light enters inside your eye and you have a floater in the center or gel in the center, you tend to bypass it. You reduce the contrast of the eye to perceive the problem less, but they don't treat the problem. Now we come to the third treatment option, which is lasers, or we call it as YAG vitrolisis. So imagine you spoke about the V's ring, the
Yeah.
central ring kind of a thing. So it's a fibrous gel which is floating in the center. So common sense is, how do you remove it? The most non-invasive part is you do YAG vitrolisis. You create micro bursts with a laser inside the eye and break this into multiple pieces. All right, and now you don't see that ring. Patients are happy with it. Not all of them, but a substantial number of people are happy with it. But there is a selection criteria. Not everyone can go for, and not every floater can be treated with these lasers. So it's absolutely to the discretion of a specialist. Very few people do it. The people who do it should be knowing very well what can be repercussions, what can be complications, and how to manage them. And those have to be explained to the patients before you take up for a treatment, because it might sound very robust, but you are creating kind of micro explosions. They are safe in general, but micro explosions can create problems to the other part of the retina as well. Fourth option is the surgical option. Uh, Surgical option is, again, it's been debated amongst the retina fraternity a lot whether should we go in for the surgery or not. If you want my opinion, what I do with my patients is I ask them to stay put and see if you can manage with this floaters for 6 months to 1 year. If they still come back to me and it is still bothering them, in that case, what we recommend is, depending on the selection criteria, either we ask them to go for lasers, or the option of retinal surgeries are given to them. We can discuss about the retinal surgeries in the following.
So, Doc, can you elaborate more on the surgical treatment option for eye floaters?
Sure. So surgical treatment option is a surgery called as vitrectomy. So I told you about the gel, which is called as vitreous. Removal of that gel is called as vitrectomy. It's very simple. Uh, a vitrectomy surgery is done for very complicated diseases also, and a span duration of the vitreous surgery can range from 10 minutes up to 3 hours, depending on the complexity of the cases. So we use vitreous surgery for a lot of things like detached retinas, bleeding retinas, diabetic patients, intraocular traumas, complicated cataract surgeries, and a number of different indications. Doing a vitreous surgery for floaters is the easiest indication. It literally takes 10 to 15 minutes. It's a keyhole surgery. We make three small holes in the eye, which is a 27 gauge holes. And we have those technology now. We have those kind of cutters and suckers, which actually go in, they cut the gel and remove the gel at a very, very high rate. So we have the technology which can actually, it's a kind of gully technology, which can cut at 20,000 cut rate. Okay. So which is really very high. So surgeries have become very safe over a period of time. What we do is we go inside the eye, we remove that part of the gel which is obstructing the vision. We try to remove it almost, let's say, 90% of it, and that's good enough for patient to get symptom free.
But are there any risk and complications associated with the surgical part?
Well, see, risk and complications are associated with every procedure. If you talk about the safety of the retinal surgeries, per se, the safety of vitrectomy for floaters is not defined, but the complication rate of the retinal surgeries of vitrectomy is 1 in 650. Okay, and that's when we're talking about all kinds of skill sets, all kinds of machines, which also include inferior machines. We also include different kinds of complicated symptoms. All right, so this is an easier symptom to treat, easier pathology to treat. So we would expect the complication rate to be much, much lesser. Complications can be retinal detachment, bleeding inside the eye, a low pressure in the eye for some time. These are the most common complications. But in an experienced hands, there are strategies to deal with these experiences. For example, once we have cut the gel, we screen the whole retina to make sure that there is no existing pathology, there is no retinal insult remaining behind. So, and obviously, we have the machines that we use are massive. They're very high tech instruments which have got sensors, which have got beautiful optical devices which show us everything, and we are in complete control of it.
So, Doc, let's say a patient comes in for the treatment for eye floaters. What timeline are we looking at?
It's not a defined timeline as such. All right. Obviously, we know once we've ruled out that the retina is fine. All right. If there is a retinal injury, then we want to treat it ASAP. Again, within the next 48 hours, that has to be addressed. Now, I presume we are talking about the patients who have not had a retinal injury. So, when you are dealing with such a patient, we generally try to be conservative. We would tell him that, see, these are acute floaters, just wait for some time. See, there is something called as neuroadaptation. You need to understand that. You know, typically speaking, let's say if you have a scratch in your glass, initially when the scratch is there, you feel a little awkward. And you keep removing your glass and you keep wondering, should I change the glass or not? You keep wearing the same glass over a period of 1 month, you tend to get used to it.
Used to it, yeah.
And then someone else will tell you, hey, you got a scratch on the lid, you didn't notice it? I said, yeah, I tend to ignore it. So that's neuroadaptation. That happens. And it's a very strong phenomenon. So many patients become very comfortable with neuroadaptation. We give them a year time to neuroadapt. But even after that, if they come back to us with symptoms still persisting, then options of lasers and surgery are open, depending on what is their our selection criteria and what is more safe for them.
So, somebody going in for the laser option or going for a surgery option. So, how long is this patient going to stay in the hospital?
And that's again a very good question. Lasers are done in the OPD basis. Okay, it's something you walk in, you have to wait for 30-40 minutes. We put the drops and dilate your pupils so that the surgeon or I can have an access to your gel. Uh, there is a sitting instrument. I mean, laser is not a very complicated instrument as such. So you sit across it, I sit across on the other side. You don't feel any pain, no anesthesia is needed. All right. You do feel a kind of noise of those microbursts, and I can, using a lens, I can actually focus that particular pathology and burst it through the laser. It takes 2 to 3 minutes. All right. You can immediately go back to work. Laser does not create any, there's no downtime with laser. What you can actually do is you can go back to your work immediately. The only problem is dilatation, and that dilatation effect stays for 3 to 4 hours.
And how about the surgery part?
Yeah, so surgeries are in our setup, we do it as in daycare surgery. So you have to get admitted, and that's actually the requirement from the insurance. All right. Uh, it's a short admission for a couple of hours. Again, your parameters are checked, you have to prep for a surgery. So the preparation is as good as any major surgery. And that is because we want to be sure that physically or eye wise you don't land up into any kind of problems or complications.
So, Doc, I also would like to know that are there any myths associated with eye floaters? Do you hear any of those in your practice?
Yeah, there is one myth which has been spread by, unfortunately, by a lot of my colleagues, and which simply is make peace with the floaters. You really don't have to make peace with the floaters. All right, we live in a different world altogether, and definitely treatment options are available. Try to make peace, but if you're not, don't fight with it. Okay, come back to us. Procedures are very safe. Just make sure a surgeon that you choose is experienced enough, that who is routinely dealing with this kind of disorders, who has done thousands of retinal surgeries or vitreous surgeries, so that you are in the safe hands, and go ahead from there.
So, Doc, Out of all the treatment options that we discussed for eye floaters, which one you think is the best?
Well, the strategy is very individualized. All the treatment options are kept on the table with the patient, understanding the needs of the patient, what he does, what his psyche is, how is his neuroadaptation working to the floaters, and then we discuss. So it's really difficult for me to say which one is the best option, but I can give you an analogy, about if you really want to compare all the three options. Let's say we are talking here and there is some mess lying in the room, some dirt or, you know, and we don't find it fascinating to sit here because there is a mess in the room. So there are three ways of dealing with it. One thing is I can say, Aditi, don't focus on me, focus on what we are talking, ignore it.
Yeah.
Fine, for many people that will work. Second thing is I take a bucket of water and just splash that thing. That's laser. Okay, that's what laser does. So it actually removes that mess. You're not seeing that concrete mess, but it's all over the room now. But it's fine. Okay, it's not attaining your attention right now. And the third method, which is the surgical method, is we take the bucket, we splash the water on that mess, we take a scrubber and we clean the whole room. Which one would you prefer?
I think the last one.
So that's my answer.
Yeah. Doc, if a patient is really anxious, like he wakes up in the morning, starts seeing floaters, and his vision is disturbed and is very anxious, and he comes to you, what would be your first step, and how do you counsel this patient?
Calm down,
Okay.
take a deep breath. Uh, you've come to me. I presume he's come to me, so he's in safe hands. Okay?
Yeah.
So it's not something that will hurt his vision in the long term. I do understand in the short term or today, he does have a problem and he's anxious because he's woken up with this kind of disturbance in the vision. Understand what I'm saying, all right, what I'm doing. My first step is to make sure it's not a harm done to the retina or the inside of the eye. If it is, I treat that part. Okay, floaters can stay, they don't create any harm. And then we take it up about how to deal with the floaters eventually over a period of time that I explained.
Right.
Okay, so there is no need to panic. Just be sure, don't keep ignoring, don't presume this is because of cataract or something else. Don't presume that one of your friends had it and he never had a problem, so you will also not have it. And try not to rely too much on AI, Google or Chat GPT. See a doctor. I mean, you are staying in a community, you are staying in Dubai, you have a retina surgeon available in every nook and corner. All right. So you can go to anyone or ask for a referral for a good retina specialist. All right. Someone who is trained to specifically examine these particular problems. So nothing would happen. It's just a passing phase. We'll deal with it.
So, coming to the next question, if there is one thing that you want your patients to understand exactly about eye floaters, then what would that be?
One thing, you want a single message,
Yeah.
rush to the doctor.
Okay.
Rush to a good retina surgeon. Okay, that is the one thing you need to do immediately. See, I'm a retina surgeon. I also treat retinal detachments.
Right.
All right. And we see, let's say, 2 to 3 retinal detachments on every week. And whenever I ask a patient that, were you seeing some floaters in past 1, 2, or 4 weeks, he would always say yes. So why didn't you go to a doctor? Doctor, I thought it would be fine. My father had the same problem and he is fine. My friend told me, ignore it. I started using some kind of drops. I thought it'll settle down with that. Or I went to a doctor and the doctor said, don't worry, it's fine. All right. So, I mean, many times these things are mismanaged and then we are dealing with a very complicated scenario. We don't like to deal with it as a surgeons itself.
Doc, we spoke about the post-operative instructions for the patient. Now, for somebody who uses contact lenses, is there a downtime for this patient? Any precautions that these patients have to take?
Well, once you have recovered from your anesthesia, I presume you're talking about the surgical part, right? Post surgery. So, once you have recovered from your anesthesia, which is like 4 to 6 hours after the procedure, you can use contact lenses. You want to play safer, just start using contact lenses from next day onwards. You will be using some eye drops for, let's say, a couple of weeks, but contact lenses don't interfere with those usage of those eye drops at all.
And any special instructions for our ladies who do the eye makeup?
Not really. You can do that next day. See, these surgeries are done through very small keyholes, and they close immediately. All right. So we don't expect any leakage in and out of it. All right. So eye makeup is not a problem. I mean, my patients can do eye makeup next day.
Let's go to the audience. Audience, do you have any questions?
We can keep rolling as you're asking.
Yeah.
Something simple anyone can do to have good eyes, like good vision in that case.
You want to have good vision. So Tony has asked me what is the best way to have good vision.
Yeah, to keep your eyesight like nice, like without complicating anything, like fancy stuff.
Be healthy, healthy living, high thinking. Stay away from digital devices as much as possible. Okay, and eat good, do your workouts, just be healthy. That's eyes are basically a reflection of your whole body.
So how about the situation about your laptops, cameras, like that's your life. So what could be?
Well, that's unfortunate. Okay, that is really unfortunate, and
I
yeah,
have an interesting question
you
around
can
this one.
actually use this digital devices for your professional use, but I'm sure we are using them for personal use, social media also for long period of time. At least that can be cut down,
Okay.
right? I don't think we have any option in terms of not using them for your work purpose, but definitely social media time can be cut down. This is what we tell to the children when they come to us. Parents often ask that he uses his laptop for his education purpose, but then he's on the social media for next 3 to 4 hours video gaming. I think that can be cut down a bit.
So the
That's
idea
healthy.
is to reduce on the social media exposure need.
Well, that is the only thing you can do unless you really want to resign your job and you know go back to probably 20 years back. Unfortunately, we don't have an option.